Having chronic acid reflux not only is uncomfortable, it can be dangerous. People who've been dealing with it for longer than 5 years are actually at risk of developing cancer. But the good news is there is treatment close to home. Learn more about it in today's MedWatch report.
Yeah, I was concerned about taking the pills for so long.
Stephen Christ is checking in with his doctor at Munson Medical Center, just 26 miles from his home in Benzonia. He was driving 800 miles to the Mayo Clinic for treatment.
How are you this morning?
Good. How you doing?
Good, thanks.
It was at times horrendous because my wife doesn't drive much, and I did most of the driving, and you're not supposed to drive the day of the procedure, so you either have to stay longer or you just have to drive. And it's quite a haul. You have to go all the way through Chicago. During the summer, you can take the ferry across, which is a lot better, but it gets to be expensive.
Stephen has Barrett's esophagus, a precancerous throat condition that is caused by acid reflux.
There is a significant rise in cancer of the esophagus arising in Barrett's esophagus. So that seems to be one of the few gastrointestinal cancers that is actually increasing in its frequency. And it probably relates to the American diet and obesity.
When Stephen was originally diagnosed, he was sent to the U of M, where they wanted to remove his esophagus.
I did not particularly care for having my throat removed. It's 9 inches of your throat. They have to bust a rib and they disconnect your stomach and then pull it up and staple it.
When he did some research, he found radiofrequency ablation at Mayo.
So we can insert the instrument into the esophagus and then essentially burn or singe that inner layer right off with the endoscope. And then as long as we aggressively treat reflux, then what grows back into its place is the natural squamous cells that belong there in the first place.
Doctors do the treatment about 4 times over the course of a year, and that typically takes care of things. When Stephen had a recurrence, he learned about Dr. Robert Barnes and found he had a much closer option for treatment.
They're pretty much got it under control, and if they can get rid of it completely, then I'll just have to come back like once a year for a checkup, and that's it. You know, cancer-free. Don't have to worry about it. It's good.
For MedWatch, I'm Michelle Dunaway.